All right, study hack number 9. Yes, okay, this time it's 9. So again, this comes from Contemporary Theories of Learning, and this tip is specifically for medical students. And so I'll start with, one of the chapters in this book is authored by Nud Ilaris. I just want to give credit. And in this, he gives the different styles of learning, the most common of which being assimilative learning or learning by addition. And this is basically learning in layers. So you learn the base concept, then you learn another concept related to that, you learn in more detail, you learn another related concept, and you're basically learning in layers. Now, this is a great way to learn because your brain can attach new information to previous information. And remember, unless that is the case, your brain's not going to store new information without extra cognitive effort. And again, we want to get more out of our studying with less effort. So that's why assimilative learning is best, easiest to teach. But there is a problem. And so he says in here, this is why problems are frequently experienced in applying knowledge from a school subject to other subjects in contexts outside of school. This is why it is vital, absolutely vital, for medical students to learn their curriculum as best as they can in context of actually treating patient pathology. So pharmacology, for example, if you just memorize the drug names and their MOA without the context of using it to treat patient pathology, you're going to have a real tough time when you're actually in clinicals and when you're actually a resident and you have to apply the information you learned in school to actually treating patients successfully. Because you learned it in a specific context, which was just memorizing the MOA and passing the test. The goal is not to pass the test, kind of it is, but the ultimate goal is treating patient pathology. So if you learn in that context, 1, you're going to be able to pass the test because it will coincide. 2, when you actually get to clinicals and treating patients, you've already learned it that way. You can apply it in that context. Excuse me. That is why it is vital for medical students to learn stuff like what they're learning, pharmacology, epidemiology, whatever it is, in the context of treating patient pathology. It is crucial. It will save you time, save your cognitive effort, and you will pass the test and do well when you're actually treating patients.